First of all, really welcome here in Baveno for the annual meeting of PROMS. First of all, let me say hello also and welcome to the 50 people who are connected with us. It is really a great pleasure and really high participation to this type of event. I think it is about 4 years now that we are running. There was some preparation, and here today we have particularly the responsibility to come up with some concrete plans for the future activities. Just before we start to go in details about the meeting, I would like just to tell you about, for those who are not so confident with the organization of PROMS, some information about PROMS. It is really a global initiative jointly organized by the MS International Foundation and the European Charcot Foundation. I think that here we have also a key role that is played by the Italian MS Society. And let me start expressing my gratitude to Mario Battaglia and to Zaratin for the incredible contribution. But again, it is really a global initiative. This was since the beginning, and also it was increased in terms of participation over time. Just a few notes about the governance. We have an executive committee with the responsibility of strategic decisions, and then we have a scientific steering committee in charge of all the definition of the scientific plans for the activity. And we have a management secretariat, many thanks to Valentina Taggeo, Francesco Carmonita, Valentina Parodi, Fabiana Totaro, and Anne Helm, because these are the persons who are working every day on the project. Really a lot of fundamental contribution here. We have started our activity with 4 different working groups, and here you see the composition of this working group. Most of the members are here or are connected with us. We have a clinical management group, and we have one group that is dealing specifically with the e-health. And finally, we have what I can say a bit a strategic group in terms of the penetration of PROMS and the possibility to have a key role for PROMS in the future, not only in the present. And again, we will hear something more about that later. Having said that, I would like to ask to co-chair of this initiative, Baneke for the MS International Federation, to come to the podium.
Good morning. Those are in good morning zone, and good evening in other zones, and good afternoon to all of you here in Baveno. It's a pleasure to be here, and a warm welcome from all the MS organizations around the world. Just a few words. From the perspective of people with MS and MSIF's member organizations represent very many of those. Of course, we want the very best representation on what matters to people with MS and what's going on in their daily lives. And the PROMS are crucial for that. And from the research and the clinical perspective, of course, the MRIs and the other outcome measures, they can't catch everything. And for example, progression is one of the themes today. Do they catch that? They can't catch everything. So that's the logic of having the Charcot Foundation and MSIF as the initiative takers for the PROMS, and now it is much wider, and that's fantastic. Have the research community, the community of people with and affected by MS, have pharmaceutical companies involved, importance of the regulators and many more stakeholders, of course, over time. So this is crucial. In all of this, and in the whole project, the people with MS play, of course, a crucial role. And the crucial component of that, is in the governance of the project, is the so-called ECT, the People with MS Engagement Coordination Team. It's not that that team is the engagement with people with MS, because it's a small team, but they are the ones who try to ensure that we can reach out to the widest possible pool of people with MS around the world. And therefore, it is my pleasure to introduce Helga Welland from South Africa, who is the chair of the ECT. Helga, over to you.
Thank you very much, Pierre. Good day, ladies and gentlemen. The PROMS strategic intent is to engage with people with MS to create a picture of their status today and the changes that they're experiencing over time. This will facilitate active and passive monitoring in a holistic and personalized way in order to improve the prognosis, prevent progression, and improve the lives of all people with MS. As we all know, multiple sclerosis is a complex and unpredictable disease of the central nervous system, affecting millions of people worldwide. Its course can be highly variable, making it challenging for healthcare providers to monitor and manage effectively. Historically, conventional clinical measures alone are used to gauge disease progression, but these often fall short of capturing the full patient experience. It is at this point that we look forward to the use of digital active and passive monitoring and capturing data with the use of digital devices. Patient-reported outcome measures are assessments of patients' health status directly reported from the patients themselves. In the context of MS, PROMS encompasses a wide range of aspects, including physical, psychological, and social well-being. By collecting this valuable information from patients, we gain a more comprehensive understanding of how MS impacts their lives. Gathering this data directly from patients is to capture the full spectrum of progression in MS within a global context, while also measuring changes over time in an effective and personalized care setting. Capturing changes or progression, including silent or unrecognized progression of multiple sclerosis, is a key aspect of patient care. Changes can be so small that they could easily be overlooked in the short contact appointments that patients have with their clinician. Continually capturing these small changes with the use of digital devices can lead to a much more effective and immediate attention to disease changes. Gathering this information into scientific data and research are essential to healthcare and have the potential to revolutionize the way patients with multiple sclerosis are treated on a global scale. In a global setting, the use of PROMS becomes even more significant. MS is a worldwide issue, affecting millions of people across diverse cultures, environments, and socio-economic settings and healthcare settings. In regions or countries where there is a smaller prevalence of MS, patients often don't have access to a specialist clinician. In this setting, digitally monitoring and collecting PROMS can assist and support clinicians in identifying changes and managing the condition by incorporating PROMS into patient care. Thereby, we create a common language that transcends borders and allows for a standardized approach to assess and address the disease's impact. This facilitates international collaboration, research, and exchange of best practices, ultimately benefiting patients everywhere. Furthermore, measuring changes over time is crucial in managing MS effectively. A digital approach of gathering data provides a dynamic snapshot of a patient's health journey, allowing healthcare providers to track not only the disease progression, but also the response to treatment. This real-time feedback empowers clinicians to make timely adjustments to care plans, thereby optimizing outcomes for individual patients. The patient understands, feels included, valued and heard in the information exchange with their clinician. However, the true power of PROMS in MS lies in their ability to personalize treatment and support. Each patient experiences the disease differently, with unique symptoms, challenges, and responses to treatments. By incorporating digital technology in PROMS, care plans can be tailored to meet specific needs and aspirations of each individual. This patient-centered approach not only improves the quality of care, but also enhances patient satisfaction and overall well-being. However, this can only be possible with the commitment of clinicians and patients alike. In conclusion, the use of digital technology in PROMS enables capturing the full progression of multiple sclerosis in a global context, while measuring changes over time is a game changer in MS care. It provides a holistic view of the disease, fosters international collaboration, enables timely interventions, and, most importantly, personalizes care to meet individual patient needs. Considerations will need to be given to the barriers, the benefits, and the cautionary measures of collecting this data. And we look forward to those discussions with other ECT members later today. As we move forward in our pursuit of better MS management, we recognize the power of digital technology as a vital tool in healthcare management, thereby bringing us closer to a world where MS is better understood, better managed, and hopefully, ultimately, better overcome. Thank you.
Thank you very much, Helga. I think this is the voice of the persons with MS. I think this is a bit the fundamental aspect of PROMS, because we would like really to give value and power. Both aspects are relevant for the voice of the person. And it's now my pleasure to introduce Paola Zaratin, who is co-dividing with Patrick Vermeersch the responsibility of driving the scientific activities. Paola.
Thank you, Professor Comi, and good afternoon and good morning to everybody. And it is also my pleasure to welcome you all to our annual plenary event, together with my fellow co-chair, Professor Patrick Vermeersch. And as well introduced by Helga, the PROMS initiative aimed to give content of validity to a renewed concept of value, of humanism, from research to care, by making experiential knowledge of people living with a disease scientifically meaningful for all the other stakeholders. And this is not a tokenistic intent, but indeed this will represent a return of investment and return of engagement for all the stakeholders involved. And why? Well, I think you agree with me also based on our extremes meeting that there is a demand for a general shift towards predictive, preventive, and personalized medicine. The value-based care approach promoted by European Commission put personal value at the core, at the center, and we need to ensure that each individual patient's value are used as a basis of decision-making in a way that optimizes the benefit for them. And last but not least, as we have heard from Helga, digital technology is the method at the service of this paradigm shift if we will be able to incorporate, take on board the perspective of people living with the disease, offer tool, methodology to support this paradigm shift. And if we zoom on multiple sclerosis, this is even more true, because I'm masking the hidden part of the iceberg. unmasking the unrecognized progression, call for a paradigm shift between patient-centered approach to patient engagement approach by using innovative, responsible research innovation model promoted by European community as well. And if we are good in patient engagement, if we are good in promoting science of patient engagement, we are going to collect patient-generated data with higher content of validity and from research to care, leverage both on active, but mainly, as we heard from Helga, on passive digital monitoring. And when we are talking about patient-generated data, we are talking, of course, about patient-reported data, but also about the patient-reported experience on healthcare service, and more importantly, about patient preference and acceptability for healthcare innovation, including the digital technology and device. So this is why the true aim of this initiative is to maximize the impact of science with and of patient input. This is our job, and we believe that if we will be good at this, we will provide a unified view on patient-reported outcome to all the relevant stakeholders. And of course, to do this, we recognize, to fulfill our mission, we recognize the importance to adopt, to apply a participatory governance. And again, people living with the disease inform the initiative direction via engagement coordination team and bring their experiential knowledge into the research agenda. And the concept of the engagement coordination team was developed within European project Multi-Act exactly to enable representative inclusivity. So far, we will be focused on having patient expert at the table. Now we want the community that is expert on all the experiential knowledge that are relevant for research and care. And so far, we have been investing in enabling participatory governance. We are strengthening our collaboration, established partnership, and as well as we have understanding the state of art of this field, not easy job, and try to come up with global landscape of PROM for MS, trying to answer a series of questions. We are here today, and our job today is to reflect on our achievements versus other very important relevant initiatives, try to come up with an initiative, a PROMS initiative that can add the greatest value and have big impacts for people living with MS, but not only, also for people living with other neurodegenerative disease, because this is a priority for all the neurodegenerative disease field. And today we want to ask specifically this question together with you. We want to understand what would be the added value in using PROMS to identify unrecognized progression. Will this help to create a window of opportunity for PROMS to become a primary endpoint for treatments? Can it take opportunity from this? And even more, will this represent the basis for brain health program, European program? What are the current challenges in using the same PROMS from clinical trial to care? And how PROMS achievement are helping meeting the challenges and making the effort successfully. And we are going to answer this question through the topic of our agenda, role of PROMS and patient-generated data in unmasking unrecognized progression, valuing the experiential knowledge of people living with the disease, how we can value this experiential knowledge, lesson learned from existing PROMS. We have a lot of existing PROMS, but still remain a secondary outcome in our clinical trial. The opportunity of digital patient-reported outcome measurements is myth or reality. Can we get something different out of this? And finally, we will hear from regulatory agency to understand whether what we have achieved so far, what the other initiatives have achieved so far, can change our direction and can really bridge the clinical trial with clinical care. So building on the outcome of the today meeting, we will have a dedicated meeting later in November to progress the uptake of patient-reported outcome by policymaker decision-making processes. This will be a meeting in Spain, and this will address the task of Working Group 4, and this is also the reason why we'll not find a dedicated section today to this topic. The event will be celebrated at the time when Spain, holding the regulatory presidents of the Council of European Union, and this is why it is based in Spain. And with this, I would like really to thank you, the Scientific Planning Committee members, for having made this agenda possible and for their valuable contribution in achieving this meeting. Thank you so much.